All my Yarney friends and zebras, especially zebras today, we are talking about and demonstrating or doing a little quick video of what happens every 3 weeks for me, minus my hand up here. I've taken my pre-meds. They came in this bag. I have my very important epinephrine injection, just in case there is a reaction to any of the infusion that I'm getting ready to take. I've already taken my temperature. It is 97.5 tonight. I have my gauze pads here. I just have a stack here. Got my Alki Preps. Gloves. I do have those. Just a little bit of meditate. The syringe that I'm going to use to draw out the high of HyQvia. This is the hyaluronic acid, human hyaluronic recumbent. That's going into my thighs. I have already prepped my thighs with a numbing solution. I am wearing shorts, don't panic. This is where one of the injections, the needle site, is going to be on that thigh and over here on this thigh. And this is prepping right now. There's numbing cream underneath here. Underneath the gauze pad is numbing cream. You usually apply that about 45 minutes prior to starting your infusion. And that's been prepping probably for about 25-30 minutes now. And this is all of the other stuff that's going on here. I'm going to move this since it's glaring. And I'm going to put the camera down and get started because I've already taken my pre-meds. It does make you muscles relax a little bit. I do take a muscle relaxer and Benadryl to help me just to relax and not have reaction. So the first two little bottles are needing to be taken out of this with the syringe. And both these small bottles, the high part of HyQvia is injected into the into my thigh to prepare my soft tissue to absorb this portion of the infusion, or as we call it, liquid gold. If you have CVID or hypogammaglobulinemia, that is why I'm called a zebra. You normally have an infusion that you do. Some people do it at the hospital as CIG, and I do mine at home subcutaneously. So others get theirs at the hospital, at an infusion center, and I was actually trained to do it at home. So behind here is my pump that works my IV. I got my IV pole right here. This will hold my pump, and I am doing this in my yarnery because this is where I spend the majority of my time. But these are the batteries that go in this pump. All of the fluid that is going to be, I've already washed my hands in case anyone is questioning. That is very important that you have your hands are clean. When I start working with infusion, I will use my gloves. But right here is the IV bag. that the HyQvia fluid will be going into, and it will hang right here as it infuses overnight. I do infuse at a very slow rate because of the amount of medicine that is going into my thighs. It does make a little swelling, like a pancake kind of swelling area. So I'm going to get right to this. It is a process. I have my camera, my tripod sitting over here. Not sure how much we will be able to see. I will try to get myself out of the picture as far as my thighs or whatever. My tripod is pretty low right now. I don't think it's going to get any lower. I will do my best to try to see what's going on here. First things we're going to do here is remove this, and we have the tops of the vial. And it is very important to clean that. So I'm going to sit this down, and we're going to do a little cleaning here of these, just in case there's any kind of contamination. Okay. All right. Let me go ahead and do this one while I'm ungloved. I'm going to go ahead and do this one, and they'll both be ready for me whenever I get everything prepped. So these two have been, the lids have been removed. I'm going to get my gloves on here. Probably can't see a whole lot because I don't have a very professional system, but for anyone who may be curious of how I do my infusions at home, this is it. So I'm getting ready to put a blunt needle on here so that we can go ahead and get started with okay, here is the blunt needle. I'm going to put it right on here, pull this off, and give you a look-see at that. Hoping that's focusing in so you can see. It is not a sharp needle, but it is sharp enough to go through the top of this vial. And I'm going to just push this straight down in through here. There we go. Okey-dokey. So you can see it's gone inside. I'm going to remove it again because one of the ways to get the medicine to come out is to put some air in here. Get your air in it, and we're going to re-inject. Turn it over, push the air into the bottle, and watch the medicine. The high is going to start coming out. I hope that's focusing in so you can see it. Now, you do pull down on this to make sure you get every drop. A little bit of air going back in there. Pull down just a little. This is liquid gold, y'all. We do not waste any of it. You do get a little bubbles in there. Get out as much of that as you possibly can. If you need to wiggle this around a little bit and see what you have. I think you have all of it. Yes, nothing left in there but a few air bubbles. And that's the only one. It says here, infuse first. So that's coming out. This is not being used at all right now. I'm going to set this over here and let it wait its turn. Okay. Now I know that this is still a clean needle, and it just dropped it in the floor, but because I have on gloves, I'm not going to pick that up right now and contaminate what I have already cleaned up. I am going to carefully, I don't want to spill any of this, put all of these little pieces in here. And since that's not a really sharp needle, it's a blunt needle, I'm not going to be in a panic over that. I don't have any little peoples in my house that will get into that, pick it up. So I'm just going to do this. Am I still in the screen, guys? I'm not even sure, but here we go. Putting a new one on. Okay. Got to get this new bottle of HyQvia. We're going to take this top off. Just twist this off and pull up. Okay, we still have a little air in there. I'm going to give it a little more air so that we can draw the rest of this high out. And I'm going to just go ahead and flip that so you can see what we're doing here. Just push that straight up in there. Put a little air in. And it's going to push itself out. Pretty much. Get a little more going on here. Get all these bubbles out. Here goes. As you can see, that medicine is coming out. And a little more air. Bubbles are coming out of there. It's coming down. As I do that, I always wiggle this a little bit to get my blunt needle down so that I can get as much of that high out of there as possible. I don't want to leave anything in there. This is very important in getting your soft tissue ready to receive all of that other liquid. So this is like a plumping solution. I consider it like a little plumping solution that will cause your skin to raise up and make room for what you're getting ready to put in. I think we have about all of it out. Got a few more bubbles coming. Be careful as you pull down. You don't want to totally lose that, all of that that's in your syringe. So always be cautious how you are pulling that down. You don't want to go to the bottom here. Just get all that you can. And be really careful at the end here as you're pulling this off, because you may get a splash back. There we go. It's all out, guys. You just take this and lay it down right there. I'm going to put this lid right back over that. Okay. I'm going to try to get this to sit up straight because we don't want to get any aggravated air bubbles in there. So this is ready to be attached to the needles. The needles don't go into my skin yet, but we got this ready. I'm going to lay it down. I usually do this at my kitchen table. I have more space, or downstairs in my living room. So move this bag. This is the needles. I use 2. Oh yeah, I use 2 needles. These are the Tegaderms that come with this to secure the needles. in your skin. The butterfly, they call these butterflies. But we're going to go ahead and sort this out really quick so we can see what's happening here. Do it as quick as reasonably possible. Okay, untangle this little part here. This is going to hook up to the syringe that I just did all of the, put all the high in. This is going to hook up to the syringe. But before doing that, I am going to put a lock on this. Yes, I'm going to put this little lock down here so that I can dry prime those needles. One thing you do not want is to have the medicine come all the way up into this and come out the needle, which is secured right here. There's a needle. They call this a butterfly. Looks like got the wings, but this is the needle. And they did not send me the small needles I requested. I've been struggling getting these needles into my skin because I've done this for so long. I'm sort of calloused, but this comes off, and there is the needle. It's not really big, but it's giving me some grief recently, trying to get it to go. Okay, so I'm gonna put that little cover back on that, close this back up because it does have a little click that will close it back up. And these are locked. Both sides are locked, which means the medicine should not get to the end of the needle. So we're going to go ahead and hook this up to this baby. All right. This is a process. Yes, you can do it yourself. Don't panic. If you ever have to do your own infusion treatment, trust me, you can do it. Okay, I'm just going to very gently work this up. And I'm telling you now, these tubings are so thin. It's really hard to even see that it's going anywhere. Got a little bit of air right here, but there's tiny bubbles moving. You just get those little tiny bubbles. You can watch them go into this tubing. The important thing is not to get it all the way to the end of the needle. And it's not going to be able to do that because I do have it locked right here. So it's not going to go all the way there. Every now and then you'll get one that does not follow protocol. It does leak through for some very strange reason. But I've got that going. And now I'm going to, yeah, there I can see it moving. Okay, I'm going to secure that right here. It's not going anywhere. It's on lockdown. I'm going to lay it right here and get this bag out. This is the bag that all of the big bottles is going to go into. So I take my big bottles and have them cleaned. We already did that. But I also need to pull out this gravity bag, gravity fill set, and this piece gets attached here. Take that one off and this one off. And it's a male and female set, and you just join them right here. Okie All right, and so this part, this part, like the blunt needle that I used earlier, is much larger and stronger, and is going to go into the top of this and draw this out. But before we do that, I'm going to lock this little clamp, and this little door here is closed. I call it a door or a window. It's closed. So we're going to go ahead and flip this up and go right into that hole. Well, it's not a hole, but it's a dimple. It's got 3 dimples there. You go into the big one right here. You push down. You have your needle or blunt thing all the way up in there. This is going to go out. It usually goes out really quickly. This comes off. Are we still recording? Oh my God. I think my crazy just died on me, but hey, hang on.